Good morning, class.
Good morning, sir.
How are you doing today? Oh, we thank God for such a lovely day. So this is the first year, first semester class at the nursing training school or nursing training colleges. And one of the mandatory courses that you will be doing this semester is Human Anatomy and Physiology 1. So this morning, I want us to talk about an introduction to human anatomy. Right from the SHS level, you've heard about anatomy. So I want to introduce you to what anatomy is. The course code is BCA 101, BCA 101, and it's a 3-credit hour paper. My name is Mr. Samuel Kwaku Dwomoh. Currently, I have an MPhil in Human Anatomy and Cell Biology from KUST. At the same time, I am also a student pursuing MPhil at the University of MPhil Nursing at the University of Ghana, Legon. I also have a Bachelor of Science in Nursing from KUST, Diploma in Education from University of Education, Winneba Kumasi Campus, now Amstead. And then I am a registered general nurse, currently at the level of Deputy Chief Health Tutor or Deputy Chief Nursing Officer. And I am also the HOD for nursing at the Nursing and Midwifery Training College, Dunkawanofin. And occasionally, in the absence of the vice, I also act as the acting vice principal. So our learning objectives for the introductory anatomy will be, we would want to look at the definition of anatomy, and then we also want to look at the various branches of anatomy. Then we will talk about the organization of the human body from the cell level all the way to the systemic level. Then we also discussed this morning anatomical positions, directions, and planes. Then we also look at the cavities of the body and their contents. And then finally, we will end this morning's lecture with the regions of the abdomen and then the quadrants of the abdomen. By the end of the class, we will learn about the 9 various regions of the abdomen and the 4 main quadrants of the abdomen and the specific organs that are found within the various regions or quadrants of the abdomen. As students pursuing nursing and midwifery, you also need other learning materials or other books to read. And some of the recommended learning materials or reading materials in anatomy are Ross and Watson, Silly R. Stevens, Science Anatomy, Gray's Anatomy for Students, the most clinically oriented anatomy, and then Atlas of Human Anatomy. That one gives you the various pictures of the structures of the human body. So Atlas is a very good book that I will recommend for beginners in anatomy by Frank H. Netter. And then Last Anatomy is also one of the books that you can go to the school's library and then read. So what is the definition of anatomy? Basically, when we talk about anatomy, anatomy is a branch of science that deals with the study of the structure of the human body. Can we all please repeat the word structure? Structure. Good. So when we talk about anatomy, assuming this is the human body, this is the skeleton or the bony skeleton, let's assume that we have the flesh and the skeleton covered. If you want to learn the structure of this human body, so you want to learn the structure of the head, the structure of the neck, the structure of the thoracic region, the structure of the abdomen, the structure of the upper limbs, the structure of the lower limb. So learning the various structures of the human body, it is known as what? Anatomy. So anatomy basically is the study of the structure of the human body. It is a Greek word that means to cut open. So in anatomy, we examine the relationship of the structures of the various body parts. So we want to talk about the branches of anatomy. Let's all say branches of anatomy.
Branches of anatomy.
There are several branches of anatomy. The first one I want to talk about is gross anatomy. Remember I told you that anatomy is the study of the structure, right? The structure of the various body parts. So in gross anatomy, the key thing that you need to know is that we are learning the structure, either the systemic or the regional structures of the body parts based on naked eye observation, what we can see. So for example, if you pick the hair, what are the things that you can observe on the head? At least you can look at the eye, right? So with the naked eye, we can see the eye, we can see the nose, you can see the mouth. So that is the part, the branch of anatomy where we study the various body parts based on naked eye observation. That one is called what? Gross anatomy. Are you okay?
Yes.
Then the next one is microscopic anatomy or histology. Let's say microscopic anatomy or histology.
Microscopic anatomy or histology.
So under microscopic anatomy, we cannot view the body parts with the naked eye observation. We can only study the various body parts with the help of what? A microscope. So we view the tissue or a section of the body part under the help of what? A microscope. And that is what? Microscopic anatomy. There's also what we call the cell biology, where basically we talk about the study of cell. A cell is the basic unit of life, the building blocks of man. We will talk about it in our next class. And then we have surface anatomy, where we study the external body parts. Radiological anatomy, the use of x-rays. And then we also have another branch of anatomy called developmental anatomy or embryology. Developmental anatomy or embryology. Here we are talking about what happens to man before birth. So before conception, when we are all in our mother's womb or the uterus, before conception, so here under embryology, we are looking at formation of the spermatozoa, how the sperms are formed, formation of the oocyte, how the oocytes are formed, and then when the oocytes and the spermatozoa come together, we get a zygote. So from oocytes, so let me write it. So under embryology or developmental anatomy, here we are looking at, number one, how the sperms or the spermatozoa is formed. And then number two, we are also looking at how the oocytes are formed. I'm sure at the SHS level, you used to call it the X. You don't call it X here. They are known as what? The oocyte. So how the sperms are formed, how the oocytes are formed, and then during fertilization, the formation of the zygote. And after the zygote is formed, in the uterus, it begins to grow. And then from the zygote, it grows to become the embryo. Let's say embryo. Then from embryo, we now come to what? The fetus. So the series of events that occur from the formation of spermatozoa, formation of oocytes, formation of spermatozoa is known as spermatogenesis. Formation of oocyte is also known as oogenesis. So after spermatogenesis and oogenesis, when there's fertilization and then the sperm fertilizes the oocyte, we have the zygote, and then within the uterus, it grows to become the embryo and fetus. So the series of events that occurs before birth, when you are in the uterus, from spermatozoa to oocyte, to the formation of the zygote, all the way to the formation of the embryo, to the formation of what? The fetus. And all the changes that happens before we are born, that branch of anatomy is called embryology. Let's say embryology. Also known as what? Developmental what? Anatomy. So these are some of the branches of anatomy. What then is physiology? Because the course we are learning is human anatomy and what? Physiology. We said anatomy is the study of what? The structure of the various body parts. So we want to learn the structure of the head, the neck, the thorax, the abdomen, the upper limbs, and what? The lower limb. This is anatomy, the study of the structure. However, when we talk about physiology, we are talking about the study of what? The function of the various body parts. So the functional relationship of the various body parts. That is physiology. The functional relationship. So here, in anatomy, if you are studying the ear, so basically we have the outer ear, the middle ear, and the inner ear. So you want to learn about the structure of the outer ear. That is anatomy. You want to learn about the structure of the middle ear, anatomy. Structure of what? The inner ear, anatomy. But if you want to learn about how hearing occurs, the physiology of what? Hearing. That one is known as what? Physiology. So whilst anatomy deals with the study of the structure, physiology deals with the study of what? The functions of the various ones. Now, another important thing that we need to know is called anatomical position. Let's say anatomical position.
Anatomical position.
Anatomical position.
Anatomical.
So what is an anatomical position? We say that an anatomical position is where an individual is standing upright, with the feet lying flat on the floor, with the arms lying on the sides, with the palms facing forward, and the head is what? Straight. Basically, that is what an anatomical position. So if you look at the slide, you say the anatomical position is a specific body position in which an individual stands upright, with the feet parallel and flat on the floor. The head is at straight and level, and then the eyes are looking what? Forward. They are looking more anterior. That is anatomical position. The arms on the side, and then the palms and the thumbs are facing away, and the palms are facing what? Forward. This is an anatomical position. It helps us to be able to measure the correct height of an individual. Very soon, as you pursue higher studies, I think during your final year, you'll be doing research. And some of you will be doing research that involves taking the height of what? An individual. And before you take the height of an individual, you need to consider what? The anatomical position of an individual. The next key thing we need to know as part of introductory anatomy is what we call directional terms of the body. Let's say directional terms. So basically, directional terms, we are referring to words that are used to describe the location of one part of the body toward the other. That's all about directional what? Terms. So the first thing we want to talk about is anterior. Let's say anterior. So when we say anterior, anterior simply means that the structure lies what? It lies in front of the body. Anterior, the structure lies in front of the body. So here, if you look at this skeleton, this part of the skeleton is called the sternum. The sternum. And then we have the vertebral column. So we can say that the sternum lies anterior to the vertebral column. The English name for the vertebral column is the backbone, right? The backbone. So the sternum lies anterior to what? The vertebral. It means that it lies in front of what? The body. The reverse of anterior is called posterior. Let's say posterior. Posterior. Posterior means that it lies what? At the back of the body. It lies at the back. So for the same example I gave, whilst the sternum is anterior to the vertebral column, we can say the vertebral column is also what? Posterior to what? The sternum. Are we okay? Yes. Good. Then the next word, directional terms are dorsal and what? Ventral. Dorsal is also related to the back side of the body. Ventral is also to the anterior side. So occasionally we can use anterior and ventral interchangeably, and we can also use posterior and what? Dorsal interchangeably. So whilst anterior is at the front side of the body, ventral is also what? At the front side. And then posterior is at the back side of the body, and then dorsal is also at the back side of the body. So in a funny way, if you have an issue with somebody, and then you don't want to really, you want to tell the person that you don't really care about what the person is telling you, we can tell you that this case to me is my what? My posterior case. Meaning that it is not a case that you really what? Think much about. Good. The next thing that we want to talk about is superior, inferior, caudal, and cranial. Superior simply means that the structure or the organ, it is towards the head end of the body. And then inferior means it is towards what? The feet. So using this bone, we can still talk about the sternum, and then we can talk about the pelvis. So we can say that the sternum is superior to what? The pelvic bone, and the pelvic bone is what? Inferior to what? The sternum. Are we okay? So the sternum is what? Superior to the pelvic bone, and the pelvic is what? Inferior to what? The sternum. Are we okay?
Yes.
Good. Then we have caudal and cranial. Caudal and cranial. Caudal means towards the tail end, and then cranial means towards what? The head end. So anytime any organ is towards the head end, we can also call it caudal. And if it is towards the tail end, we call it what? Cranial. Tail or the feet part of the body, the foot part of the body, we can call it what? Cranial. So here, we can still talk about two main bones. We can talk about the clavicle, and then we can talk about what? The femur. So the clavicle is more what? Cranial. Means it is more towards the head. And then the femur is more what? Caudal. More towards what? The feet. Are you okay? Yes. Most often during embryology, development happens normally in the cephalocaudal direction. Let's say cephalocaudal direction. Yes, normally during the formation of the newborn, development normally occurs in the cephalocaudal direction or the craniocaudal, meaning that all development begins from what? The head end of the body before it comes to what? The tail end of the body. Are you okay? Yes. Good. Then we come to medial, lateral, deep, and superficial. Medial, the word medial means that the structure lies more closer to the midline of the body. The midline, medial. The structure lies toward the midline. So if my thigh is the midline, then the structure is lying more toward the midline. Lateral means that the structure lies away from the midline. Away from the midline. So basic example, let's look at the nose or the nostril and then the two eyes. You realize that the nose is in the middle part of the body. So the nose is medial to the eyes, right? While the eyes are lateral toward the nose. This is very simple. So the nose medial towards the midline, the eyes what? Lateral, further away from what? The midline. Then we have deep and superficial. Deep means it's on the inside, underneath another structure. So I'm showing where in SHS we learned about the skin. We learned about the structures of the skin, the epidermis, the outermost layer, the dermis, the middle layer. Let's go to the board. So we have the skin. So we have the epidermis, which is the outermost layer of the skin. The outermost layer of the skin is the epidermis. Then the next layer is called the dermis. The next layer. So in relation to superficial and deep, we can then say that the epidermis is superficial to what? The dermis, and then the dermis is what? Deep to the epidermis. Are we okay? The epidermis is the outer covering. It is superficial to what? The dermis, which is the second layer of the skin, and then the dermis is what? Deep toward the epidermis. Are we okay on that one? Yes. It is very important that we understand this directional term because going forward we'll be learning a lot of things in anatomy and we'll be using these directional terms. Then we have very important directional term called proximal and distal. Let's also say proximal and distal. Proximal and distal. Proximal simply means closer to the point of attachment. And this one I'm going to use my wrist joint. When we say a structure is proximal, it means that that structure or that part of the body is closer to any point of an attachment. So the reference point is the wrist joint. We have the palms and what? The fingers. So the two reference parts of the body in relation to the wrist joint are the palms and what? The fingers. So between the palms and the fingers, which one is more closer to the wrist joint? The palm is closer to what? The wrist joint. So in this case, then we say that the palms are what? Proximal to the fingers. But the palms are more closer to the point of attachment than what? The fingers. And then between the fingers and the palm, which one is far away from this point of attachment or the wrist joint? Which one is far away? The fingers. Therefore, the fingers or the digits are distal. They are distal from what? The palm. They are distal to. They are distal to the palm. So it means that for both the palms and the fingers, the reference points are what? The wrist joint. But between the two, which one is more close to the point of attachment? The palm is closer to. Therefore, the palm is what? Proximal to the digits or the fingers. And then the fingers are what? Distal to the palm. Are we okay on that? Yes. Very good. Now, other terms are bilateral. Bilateral means that they are basically pair structures. So the eyes are bilateral. The kidneys are what? Bilateral. So when you hear the word bilateral, it means that they are paired what? Structured. And then unilateral means that that organ lies on only one side of what? The body. Typical example is the stomach and what? The gallbladder. Ipsilateral means that it occurs on the same side of the body. Ipsilateral, the right upper limb, the right lower limb, they are all ipsilateral. They occur on the same side. The left upper limb, the left lower limb, ipsilateral, occurring on the same side of what? The body. Are you okay? Then we have what we call contralateral. Let's say contralateral. Meaning that they occur on opposite sides of the body. As we move on, we are going to learn several systems of the body. And then we will learn that when we take the human brain, there's the largest part of the brain called the cerebrum, which has two main parts, the right cerebral hemisphere and then the left cerebral hemisphere. And then as we do further anatomy, we will understand that the right cerebral hemisphere controls all the left half of the body. So in that case, we can say that the right cerebral hemisphere or the right cerebrum is contralateral to the left side of the body because it controls the opposite side of what? The body. So contralateral means that the structures are located on what? The opposite side of the body. Now, we want to learn about how generally the human body is organized. And I'm sure when we were in SHS, we learned about organization of the human body. So I want just about one or two people to basically tell me what they know about how the human body is organized. Anybody from the class? Okay, so males.
Please, we have 9 organization of the human body.
Okay.
Namely the atom, the molecule, the macromolecule, the organelle, cell, tissue, organ system, and organism.
That's fantastic. Let's class for males. Any other? Benedicta. Okay.
Sir, from my knowledge, the human body is organized into organelles, and then a group of organelles form cells, and then the group of cells then moves to tissues.
Wow.
And then these tissues also come together to form an organ.
Wow.
And then the organs form the organ system, and then these systems work together for the overall function and health of the body.
Which SHS did you attend? Because that is so powerful. From which SHS? Fatima girls. Let's clap for. It's a powerful explanation of the organization. I want the last person to talk about how. Okay, sorry.
Okay, so the human body is organized in a form of hierarchy.
Good.
So from the lowest to the highest. And the first one is molecules.
Good.
That is a super tiny form as an atom. And proceed to cells. That is, those molecules come together as a collection to form cells. And then move to become a tissue. That is a lot of cells that come together of same kind to be a tissue.
Wow.
And then these tissues gather more, with more tissue, it becomes an organ.
I'm sure you attended the fancy film.
Yes. It turns to become an
Let's
organ.
clap for Terry. It's a powerful answer. Good. I think you are all right. So the simplest level of organization within the human body is the chemical level, as you were all saying, the atom and molecules. So this atom, molecule, chemical level, they end up forming what we call the cell. Let's say the cell. Now the cell is the basic structural and functional unit of the human body. The cell is the basic structure, and I want to write this one on the board. The cell is the basic structural and functional unit of the human body. So let me clean and then write about the definition of the cell. So here we are learning about organization of the human body. So we are talking about organization of the human body. Organization of the human body. Organization of the human body. So from the chemical level, we end up with what? The cells. The cell. Please, let's all see the cell. And I'm saying that the cell The cell is the basic structural, and functional unit. Is the basic structural and functional units of the human body. Can we all repeat it together? The cell is the basic structural and functional unit of the human body. We can also say is the building blocks of man. Let's say the building blocks of man. The building blocks of man or the human body. Now, let's cast our mind back to the various rooms where we want to build our house. So before you build your house, you need what? Blocks, right? Any person that wants to build a house will think of first, how many blocks will go into this house? So you think of maybe 2,000 blocks, 5,000 blocks, if it is a 2-bedroom, 3-bedroom. So the first thing you think of, apart from the land, is your what? Your blocks. And then when you get your blocks with the mortar in between, finally you get your house. Is that clear? So when God was creating man, God needed blocks to build man. And the blocks that God used in building man are called what? The cells. Are you okay? Yes. Now when these cells come together to perform a specific structure, a specific function, we call it a tissue. Let's say tissue. So when a group of cells come together to perform a specific function, we call it a tissue. And the study of tissues is called histology. We are going to talk about that in our next class. The study of tissues is called what? Histology. There are 4 basic types of tissues that are found in the human body. We have what we call the epithelial tissue, also known as the epithelium. We have the connective tissue, we have the muscle tissue, and we have what? The nervous tissue. That is another lecture for another day. Then when a group of tissues come together to perform a specific function in the body, we call it what? An organ. And then when a group of organs come together to perform a specific function, we call it what? A system. Let's say system. System. At our level, we can learn anatomy based on the various systems of the body. So for example, there's the digestive system. Organs in the digestive system, the mouth, the esophagus, the stomach, the intestine, they are all organs in what? The digestive system. So at our level, we can learn anatomy based on the systems of the human body. So the digestive system, the respiratory system, the cardiovascular system, the nervous system, we can learn anatomy. And when all the systems come together, we now have what? The total human body over there. In another way that you can also learn anatomy is by learning the various regions of what? The body. Let's say regions of the body. And the regions of the body, basically we have the head and neck region, we have the thoracic region, the abdominal pelvic region, and then we have the upper limbs and what? Lower limb. Now when you are learning anatomy based on the various systems of the human body, we call it systemic anatomy. Let's say systemic anatomy. Systemic anatomy. So here we are learning anatomy based on what? The various systems. And that is what our curriculum warrants us to do. For the nursing curriculum, we will be doing the systemic anatomy. So in anatomy 1, anatomy 2, anatomy 3, all that we will be doing is the various systems of what? The body. But at a higher level, we do what we call the regional anatomy. So for the regional anatomy, we study the anatomy based on the region. So the head and neck region, the thoracic region, the abdomen region, the abdominal pelvic, the upper limb, and what? Lower limb. And that is called regional what? Anatomy. So that is how the human body is organized. So from the cells, we come to the tissues, we come to the organs, we come to the system, and then examples of the systems are what we call the integumentary system. Let's say integumentary system. Integumentary system. The integument is the same as the skin. The integument is the same as what? The skin. So when we talk about integumentary system, it is the system that deals with the study of what? The skin and this what? Appendages. Then we have the skeletal system, as you can see over here. It talks about the study of the bones of the human body. Basically, there are 206 bones that are found in the human body, and in our subsequent classes, we will talk about the skeletal system as well. We also have muscular system, that talks basically about the main muscles of the body. There is a skeletal muscle, cardiac muscle found in the heart, smooth muscles found in the wall of the viscera. But for the skeletal muscles, they are attached to the bones of the skeleton. And there are over 600 muscles in the body. And one of the systems that you do is the muscular system. Then we have the nervous system. The nervous system basically talks about the central nervous system, the peripheral nervous system. The central nervous system, we are talking about the brain and then the spinal cord. The peripheral nervous system, we are talking about the somatic nervous system, where we learn about the cranial nerves, the spinal nerves, and the associated ganglia. And then we also learn about the autonomic nervous system, where you'll be learning about the sympathetic nervous system and then parasympathetic. So I'm telling you all this for you to know that anatomy is based on systems at our level. Then we have the endocrine system. When you hear about endocrine, don't be frightened. Anytime you hear about endocrine system, please don't be frightened. What did I say? You shouldn't be what? Frightened. Because endocrine system is all about, when you hear endocrine system is all about number one. So endocrine system, when you hear about endocrine system, it's all about number one, endocrine glands. Let's all say endocrine glands. Endocrine glands. Yes. So the glands of the body. Number two, the hormones the glands produce. Let's say hormones produced by the glands. Hormones produced by the glands. Yes. So endocrine system is all about the endocrine glands, hormones produced by the glands, and then the effects of the hormones on the body. The effects of the hormones on the body. The effect of the hormones on the body. So for example, one endocrine gland in the body is the pituitary gland. Another pituitary gland, we have the anterior pituitary and then the posterior pituitary. There are 7 hormones produced by the anterior pituitary. Growth hormone, a lot of hormones. Posterior pituitary, we have the oxytocin, right? So endocrine system, I said, it's all about the glands. Pituitary gland, which hormone? Growth hormone. What is the effect of the growth hormone on the body? It helps us to build the tissues for us to grow. So that's all about endocrine system. So don't be frightened at all. It is one of the simplest and easiest systems that you can learn in anatomy. Because your focus is just learn the glands of the body, the hormones they produce, and the effect of the hormones on the body. This is an introductory class. So at least I will not go much into details. In our next class, we will go much into details. The next system is cardiovascular. It talks about the heart, the blood vessels, blood, and circulation of blood. So the study of the heart, the blood vessels of the heart. So in the blood vessels, we are talking about the arteries, the veins, and the capillaries. And then the study of blood itself, and then the flow of blood throughout the body. Basically, here you'll be learning systemic circulation and pulmonary circulation. Lymphatic system, it helps to transport and filter lymph in the body. And then we have respiratory system that helps us in breathing. And then we have digestive system. I know you are familiar with the digestive system. The urinary system talks about the kidneys, the ureters, and the bladder. And here the formation of urine as well. And then one of your favorite systems at the SHS level, the male and female. I'm very sure if I ask you to lecture me on the male and female reproduction, everybody, including Apia Michael, will be able to teach me very well on the male and female reproductive system. So these are the various systems. So how did we come to the system? We came here because we were talking about how the human body is organized. And we began from the cellular level. We said when the cells come together, they form a tissue. When the tissues come together, they form the organ. When the organs come together, they form the system. And then we said there are several systems of the body. So when you learn all the systems of the body, then finally you get the human body. So we'll be doing anatomy and physiology 1. And after that, we will learn the skeletal system, we will learn the muscular system, we will learn the digestive system, and then we learn other systems. Then when you get to anatomy and physiology 2, you learn respiratory system and then more system. And then in anatomy and physiology 3, you learn the nervous system, you learn the endocrine system, and then you learn more system. So by the time you are done with anatomy 1, anatomy 2, anatomy 3, then it is expected that you have learned all the structures of the human body and then all their what function. Somebody will ask, as a nurse, as a midwife, why should I learn the human body? Is it necessary for me to learn the human body? And the answer is yes. The reason being that as nurses and midwives, we deal with patients. Midwife deals with pregnant mothers. Nurses deal with what? Patient. Both the pregnant mother and patient, they are all what? Human. And you can't tell me you are a mechanic, you work on the Benz filter, and you don't know anything about what? The organization of the Benz. You don't know about the steering system, you don't know about the engine, you don't know anything. So before you can be a good nurse, you need to learn the human body. So please, let nobody frighten you that anatomy is difficult. It is a must-learn course. Because if you are very good in anatomy, your nursing journey is going to be what? Very easy for you. Let's quickly talk about the planes of the human body. So what is a plane? It's an imaginary surface that slices the body into specific sections. Here we've been talking about 3 main planes: the coronal plane, the transverse plane, and then the sagittal what? Plane. So what is a coronal plane? A coronal plane is also known as a frontal plane. And the key thing is that it divides the body into anterior and what? Posterior. So coronal plane, it goes this way. It divides the body into what? Anterior and what? Posterior. Remember I told you that the directional thing, we are going to use it as we move along. And we started using anterior and what? Posterior. So when we divide the body in this way, that is a coronal plane. And it divides the body into what? Anterior and what? Posterior body part. So this is the coronal plane, the blue one, or the green, dividing the body into anterior and posterior part. That is coronal. Then we have a transverse plane, also divides the body into what? Superior. So transverse goes this way. Transverse plane. It divides the body into what? Superior and what? Inferior parts. And then the last one is called a sagittal plane. Let's say sagittal plane. So sagittal plane goes this way. It divides the body into what? Right and left portions, right? A sagittal plane divides the body into right and left. However, there is a sagittal plane that passes or divides the body into 2 equal halves. You remember in the Bible, there was 2 women who were fighting about a baby, and then the wisdom chief or the wise chief said that if you think that this baby is for you, then let's divide the baby into 2 equal halves that we say. And then the mother whom the child was not for said, yes, we should divide it into 2 equal halves. That was when the king realized that no, that is not the original mother of the child. So it means that in the Bible, there was what? The mid-sagittal plane. Let's say mid-sagittal plane. So mid-sagittal plane divides the body into what? 2 equal halves. Mid-sagittal. It divides the body into 2 equal halves. Then we also have what we call sections. Normally during dissection, we can do what we call a longitudinal or vertical section. And it cuts through the body along the long axis of what? The organ. And then we have transverse or cross section, the same transverse, similar to the transverse plane. And then we have oblique. Oblique normally cuts the body at an angle to the horizontal line. So it can be at an angle of 45 degrees, angle of what? 30 or 60. It's an oblique what? Section. Now, the regions of the body. Let's say regions of the body. There are 2 main regions of the body. We have the axial region and the appendicular what? Region. Let's say axial region. So we have the axial region. There are 2 main regions of the body. The axial region. We have the axial region, and then we have what? The appendicular region. The axial, center of axis. So it lies in the midline. So with the axial region, we have the head, the neck, the thoracic region, the abdomen, and what? The pelvis. Other books will also say the head, the neck, the thorax, and then the trunk. Or the head, neck, and the trunk. Let's say head, neck, and trunk. Head, neck, and trunk. We are not talking about the trunk that you were using in SHS. Head, neck, and trunk. But the trunk is divided into three. The thoracic region, the abdominal region, and then what? The pelvic region. So the thorax or the chest, the abdomen, and then what? The pelvis region. They form the axial region. Then we have the appendicular. Appendicular is coming from the word appendage. And appendage means an attachment. So this is an attachment to the body. This is an attachment to the body. So basically, for the appendicular region, we are referring to the upper limbs and what? The lower limbs. That's all. The upper limbs and what? The lower. So appendicular is upper limbs and lower limbs. And then the axial region is what? The head, the neck, the thorax, the abdomen, and what? Pelvis. But it is very important for us to know that between the thorax and then the abdomen, there is a muscular organ that separates or partitions the thorax from the abdomen. This muscular organ is called the diaphragm. Let's say diaphragm. Diaphragm. So the diaphragm partitions the thorax from what? The abdomen. So what it means is that organs in the thorax like the heart and then the lungs, they do not have any close association with what? The abdomen. And then organs in the abdomen like the stomach, the liver, do not have any association with what? The thorax. So what it means that any infection in the thoracic region cannot move to the abdominal region. And then similarly, infections in the abdominal region cannot move to what? The thoracic region. However, there is no partition between the abdomen and what? The pelvis. Unlike the diaphragm separating the thorax from the abdomen, there is no partition between the abdomen and that of what? The pelvis. So for most of the books, the last anatomy, the most anatomy that I've recommended for you that you are going to read at the school's library, for most of these books you are going to read and then you will come across what we call the abdominal pelvic what? Region. Let's say abdominal pelvic region. Abdominal pelvic region. Abdominal pelvic region. Abdominal pelvic. So you will come across, so under the axial region, we said that we have the head and neck regions. The head and neck regions. And then number two, we have the thoracic region, that's the thorax. And then I just mentioned about the abdominal pelvic region. The abdominal pelvic region, meaning that it's a combination of what? The abdomen and what? Pelvis. And the reason why we combine the two is that there is no partitioning between the abdomen and what? Pelvis. So let me give you a clear example of what you've been seeing in your various homes. You realize that when your mothers are pregnant, fertilization actually occurs in the ampulla region of the fallopian tube, and it's in the pelvis here. It's here. Now, when the baby is growing in the uterus, because there's no partition between the pelvis and the abdomen, the baby balloons and then it comes into what? The abdomen. So most of the illiterates, they think that the human uterus is actually in the abdominal region. No, it's in the pelvic region. But because there's no partitioning between the pelvis and abdomen, as the baby is growing in the second trimester, the baby moves from the pelvic region and it comes all the way to what? The abdomen. Is that clear? Yeah. But the baby cannot move from the abdomen and come to the thorax because of what? The diaphragm. Are we okay? Yes. Very good. Then we have the other regions of the body. I talk about the appendicular region. We said that we have the upper limbs and what? The lower. So what are the parts of the upper limb? We have the brachium. Let's say brachium. Brachium. So what is a brachium? It is between the shoulder and what? The elbow. So this area of the upper limb is called what? The brachium. Then we have the antebrachium. Let's say antebrachium. That or what you normally call the forearm, right? So the brachium is the arm. The antebrachium is what? The forearm. And antebrachium is between what? the elbow, and then what? The wrist. So that is the antebrachium. Then we have the carpus. The carpus is the same as what? The wrist. Then we have the manus or the hand, and then the digits or the finger. These are the regions of what? The upper limb. Then quickly we come to the lower limb. The lower limb, we have the femoral region or the thigh. So the femoral region or the thigh. Then we have the crural region or the crus. The crus is the same as what? The leg. The crural region or the leg. Then we have the tarsus or the ankle. The tarsus or the ankle. So if you look at the skeleton, there is the femoral region or the thigh. There is the crus or the leg. Then this part is what? The ankle or the tarsal what region. Let's say tarsal region. So the tarsal region or what? The ankle. Then we have the pes or the foot. And then finally we have what? The digits or what? The toes. So these are the parts of the lower limb. So can we quickly go to the part of the lower limb? What are they? This part is called the femoral region or the thigh. And then this part is called the crus or the leg. And then this part is called the tarsus or what? The ankle. Then we have what? The foot or the pes. And then finally we have what? The digits. Let's clap for ourselves. That's very wonderful. Then we have, so all these are the various regions of the body. So we have the pubic region, the pelvic region, the inguinal region, the cephalic, the head, the frontal, the forehead, the orbital, the eye. So after this section, I would encourage you to go and pick your Russell Wilson Anatomy at the library and then go through the various regions of the body as you can see on the board. And I believe that the more you read through and the more you practice and then you read by association, you'll be able to remember. So these are the dorsal parts or the posterior part of the body. So we have the deltoid region, the brachial, the vertebral column, the sacral region, the gluteal region, or the buttocks in English. Anatomically, we call it the gluteal region, the dorsum, and then the posterior part of the thigh, the crural of the leg, and the calcaneal or what? The heel. I think the last but one is the body cavities. Then we end with the regions and the quadrant, then we can end the class. So body cavities, what are cavities? They are spaces that are found in the various regions of the body. So as you can see, this is a cavity, a space in the region of the body. So any space, any confined space within the regions of the body are known as what? Body cavities. Let's say body cavities. Body cavities. And then in the body cavities, we have organs that are found in the cavities of the body. For example, the organs in the abdominal pelvic region. We have the stomach, we have the gallbladder, the liver, the pancreas, we have the small intestine, the large intestine, they are all in the abdominal cavity. In the posterior abdominal wall, we have the kidneys, right? In the pelvis, all the organs of the reproductive system. So your male reproductive system, the uterus, the fallopian tubes, every organ in the female reproductive system, every organ in the male, they are found in the pelvic cavity. So the organs in the abdominal cavity, they are also known as the viscera. Let's say viscera. Viscera. So when you hear the word viscera, viscera basically refers to what? Organs within what? The cavities of the body. So that is what? Viscera. What is the function of the cavity? Number one, they help to support the house and protect the organs or the viscera. Number two, they also provide what we call compartmentalization. Let's all say compartmentalization. Compartmentalization. Again. Compartmentalization. Good. So the cavities help to ensure compartmentalization, helping to prevent the spread of infection from one organ to the other. For example, in the thoracic cavity, we have the lungs and then the lungs, the right and left lungs, and then we have the heart. The lungs are surrounded by what we call the pleura, and then the heart is also surrounded by the pericardium. So this covering, they help to compartmentalize the organs in the thoracic cavity. So what it means is that any infection in the right lung cannot spread to the heart because it has its own covering. Any infection in the heart cannot move toward the lung because of the cavering, the pericardium. However, at times, we are going to do medicine. At times, we can have certain diseases that can move from one organ to what? The other. Good. Now, there are two main cavities in the body. We have the dorsal body cavity. Remember, I said dorsal means what? Posterior. And then we have the ventral body what? Cavity. So the dorsal body cavity or the posterior one, we have the cranial cavity. So the cranium is found in the skull. It houses the brain. The cranial cavity houses the brain. And then we have the vertebral canal. The vertebral canal houses what? The spinal cord. So the dorsal body cavity, we only have the cranial cavity that contains the brain, and then the vertebral canal that contains what? The spinal cord. And then we have the ventral body cavity. Here we have the thoracic cavity that contains the heart and the lungs. And then we have the abdominal pelvic cavity. The abdominal organ, the digestive organs are in the abdomen, and then the reproductive organs are in what? The pelvic cavity. So that is the thoracic cavity and then the abdominal pelvic cavity. Remember, I've already told you that it's a muscular organ that separates the thoracic cavity above from what? The abdominal pelvic cavity below. In the cavity, so there are what we call serous membranes that lines the cavity wall. We have what we call the parietal layer, the visceral layer. The parietal layer lines the internal body wall. And then the visceral layer, viscera, the organs, right? So the visceral layer covers the organs. Between the parietal layer and the visceral layer, we have what we call the serous cavity that contains the serous fluid. And this serous fluid will help to reduce friction and protect the organs in the various body cavities. So yes, I told you about the thoracic cavity. But within the thoracic cavity, we have the heart and the what? The lungs. The heart is being surrounded by the pericardium, and then the lungs are surrounded by what? The pleura. And I mentioned about compartmentalization. So which simply means that it divides the whole thoracic cavity into three main parts. We have the mediastinum. Let's say mediastinum. You may hear mediastinum. Mediastinum or what? Mediastinum. And then we have the mediastinum, the central mediastinum that contains the heart. We have the left pleural compartment that contains the left lung. And then we have the right pleural compartment that contains what? The right what? Lung. So that is the thoracic cavity. I've already told you that the coverings of the lungs are called what? The pleura, right? The coverings of the lungs are called pleura. Let's say pleura. So pleura is what? The coverings of what? The lung. We have the parietal pleura that lines the thoracic wall, and then we have the visceral pleura that lines what? The lung. Between the parietal pleura and the visceral pleura is called the pleural what? Cavity. That also contains a pleural fluid. So that is all the structures in there. So this is the central mediastinum that contains the heart, and that is the heart surrounded by the pericardium. Once again, I've told you are going to do cardiovascular system, and you will learn more about the heart. Yes, the abdominal pelvic cavity, we said that the abdominal pelvic cavity is a combination between what? The abdomen, the cavity of the abdomen, and that of what? The pelvic. Because there's no partition between them, you can combine them to call them what? The abdominal pelvic what? Cavity. So what are some of the contents? As part of your mid-semester exam, I will ask you about contents in the cavities. So you need to learn them. So you can write it down. Contents in the various cavities of the human body. You need to know them, and it's very, very important. Pelvic cavity, I've already told that in the pelvic cavity, we have all the organs of the male and what? Female reproductive organs. So what are the female reproductive organs? We have what? The vagina. Let's move up. We come to the cervix, the uterus, fallopian tubes, and then what? The ovaries. They are all in the pelvic cavity. And then all the organs of the male reproductive system are also embedded in the pelvic cavity. In the abdominal cavity, we have a double-layered membrane that lines the abdominal pelvic, when we call it peritoneum. Let's say peritoneum. Yes, so the peritoneum lines the abdominal pelvic cavity. We have the parietal peritoneum that lines the abdominal wall, and then the visceral peritoneum that surrounds what? The organs in the abdominal pelvic cavity. Between the parietal peritoneum and the visceral peritoneum, we have what? The peritoneal what? Cavity that contains peritoneal what? Fluid. And all these help to lubricate the well. So the body cavity, this slide gives us an overview of all the body cavities. So the body cavity, we have the ventral body cavity and what? The dorsal. If you remember, we said that the dorsal has the cranial cavity that contains what? The brain, the spinal cavity, the vertebral canal that contains what? The spinal cord. Then we have the ventral body cavity, we have the thoracic and what? Abdominal pelvic. The thoracic cavity has the right pleural cavity that contains the right lung, the central mediastinum that contains the heart, the left pleural cavity that contains what? The left lung. And then the abdominal pelvic cavity has the abdominal cavity, and then the pelvic cavity. We said the abdominal cavity contains all the organs of the digestive system, and then the right and left kidneys are there, and then we have the pelvic cavity containing the organs of what? The reproductive system. The last thing we want to talk about, then we end our class, are the quadrants of the abdomen and the regions of what? There are 4 main quadrants and then 9 regions of the abdomen. I think this will be okay for an introductory class to anatomy. So what are the landmarks around the abdomen? We have the suprasternal notch, mid-clavicular point, the iliac crest. We have the anterior superior iliac spine. So these are the anterior superior iliac spines. And then we have the pubic crest, the inguinal ligament, costal margins, the symphysis pubis. This is the same. So these are the landmarks of what? The abdomen. The landmarks of the abdomen. Now there are 4 main quadrants of the abdomen. We have what we call the right upper quadrant, the left upper quadrant, the right lower quadrant, and then what? The left. How many quadrants of the abdomen do we have? 4. What are they? The right upper quadrant. The left upper quadrant. The right lower quadrant, and then what? The left. So these are the 4 major. As beginners in anatomy, the key thing that we need to know is the organs found in the quadrant. So as a nurse, if you are asked to place a stethoscope on the left upper quadrant, what are some of the organs you are placing the stethoscope on? By surface anatomy, without doing any dissection. At least you know that in the left upper quadrant, the spleen is there, right? So if somebody is complaining of any pain in the left upper quadrant as a nurse, very good in your anatomy, you should know, you should be thinking about what? Splenic pain. Is that clear? Good. So that is why you need to know the quadrant of the. And then there are 2 main planes that divide the abdomen into 4 quadrants. One vertical or median plane, and then one transverse or trans. So the vertical or the median, or the transverse or the trans umbilical, it passes through the umbilical ring. And then this divides into the right upper quadrant, left upper quadrant, right lower quadrant. And I think in the slides I've given you examples of organs that are found in the various quadrants of what? Of the abdomen. So in the right upper quadrant, the right lobe of the liver, gallbladder, they are all there. In the left upper quadrant, we have the left lobe of the liver, the stomach, the spleen. I mentioned about the spleen, right? And then in the right lower quadrant, the appendix is there. So if somebody is complaining of appendicitis, that is an inflammation of what? The appendix. You shouldn't go here. You shouldn't go there. The appendix is where? In the right what? Lower quadrant. So any pain in the right lower quadrant, as a nurse, you should be thinking about what? An appendix. It could be an appendix. And then in the left lower quadrants too, we have the left ureter, some portions of the large intestine, the left ovary, all of them are in the left lower quadrant. Now the last thing we want to talk about are the regions of the abdomen. Let's say regions of the abdomen. Regions of the abdomen. That is the last thing we are talking about. Then we'll end our introductory class. So there are 9, the abdomen that was initially divided into 4 quadrants. It can also be divided into what? 9 regions. Let's say 9 regions. So there are 9. So if you are dividing the abdomen into 9 regions, then you need 2 vertical lines and then 2 what? Transverse lines. What are the vertical lines? The mid-clavicular. This is the clavicle. So the middle part of the clavicle coming all the way to what? The mid-inguinal. So mid-clavicular coming down to the mid is the inguinal ligament. So mid-clavicular all the way to the mid-inguinal. On the right, mid-clavicular to the mid-inguinal on what? On the left. This will give you your what? Your 2 vertical lines. Are you okay? Then we come to the horizontal lines. We have the subcostal line and then transtubercular line. These 2 lines will finally divide the abdomen into 9 main what? Regions. Let's say 9 regions. 9 regions. Okay, so from mid-clavicular to the inguinal line, and then these 2 horizontal planes will divide the abdomen into 9 regions. And then these are the regions of the abdomen. The one just below the sternum, here, the xiphoid process of the sternum, the lower end of the sternum is called the xiphoid process. Let's say xiphoid process. Xiphoid process. It is spelled X for xylophone, IPHOID. The xiphoid process of the sternum. The xiphoid process of, so the part of the abdomen just below the xiphoid process here, as you can see here, is called the epigastric region. Let's say epigastric region. Epigastric region. Very soon you are going to learn about medicine, and then you are going to learn gastric ulcer, duodenal ulcer, and then you hear epigastric pain. Epigastric pain. So epigastric pain has to do with what? The gastric. The gastric or what? The stomach. We have the epigastric region. Epigastric region. Let's say it together. On the left side of the epigastric is the left hypochondriac region. Let's say it together. On the right side of the epigastric region, we have the right hypogastric region. Let's say it together. Just below the epigastric region, we have the umbilical region. Let's say umbilical region. Then again, on the left side of the umbilical region, we call it the left lumbar region. Let's say it together. On the right side of the umbilical region, we call it the right lumbar region. Let's say it together. Then just below the umbilical region, we have the hypogastric region. Let's say it together. And then on the left side of the hypogastric region, we call it the left iliac region. Let's say it together. The left iliac region. And then on the right side of the hypogastric region, we have what? The right iliac region. Let me be very honest with you. As your lecturer, in your mid-semester exams, this one I will ask you, what am I going to ask you? I'm going to ask you to give me at least 4 organs. 1, 2, 3, 4. 4 organs that are found in the epigastric region, and I've given it on the board. I've given it to you in the slide. I will share the slides with you. So 4 organs in the epigastric region, 4 organs in the left hypochondriac region, 4 organs in the right hypochondriac region, organs in the umbilical region, organs in the left lumbar, organs in the right lumbar, organs in the hypogastric region, and then organs in the left iliac region, and then organs in what? The right. So as for this one, please, you have to go and learn it. I'll definitely ask you in the message, and your parents want you to pass your exam. So please, at least for this class, you should write it down that one of the things that will definitely come in your mid-semester exams is what? The regions of the abdomen. And I've seen some even end of semester questions that had regions of the abdomen and organs, at least 2 organs that can be found there. So try and master the regions of the abdomen and all the organs that are found in each of the regions on the abdomen. On this note, we bring our class to an end. These are some of the references for our lecture. Thank you. Any questions? Any questions? Any questions for me? Any questions? Yes, Mills, what's your question?
Please, I don't have any questions.
You don't have any questions? Okay, any questions? All right, if there are no questions, then thank you for your time. We'll meet another day and then continue with the study of the cells. Thank you very much and have a lovely day.